Hello, my name is Nicholas Garrity, and today I'm doing my case study on prostate cancer. I want to start with what is cancer. Cancer is a disease in which abnormal cells divide uncontrollably and destroy body tissue. Prostate cancer is cancer that begins in the tissues of the prostate gland. The prostate is the male sex gland responsible for the production of semen. About 99% of prostate cancer cases are what they call adenocarcinoma, which is when cancer develops in the gland cells of the prostate. About the other 1% are the sarcoma, which is when cancer cells are capable of developing in connective tissue, lymph nodes, blood vessels, originating from smooth muscles of the prostate. As I said, this is extremely rare. It's made up about 0.1% of prostate cancer cases. So since the prostate is near near the urethra, the prostate can get bigger and it could press on or constrict the urethra, which would cause problems in the urinary system. So here are some signs and symptoms of the urinary system: be burning or pain during urination, difficulty urinating, more frequent urges to urinate, loss of bladder control, and hematuria, which is blood in the urine. Other symptoms could be blood and semen, difficulty getting an erection, painful ejaculation, swelling in legs or pelvic area. Risk factors, one of the biggest ones is family history. Men with immediate family, such as brother or father, who has had prostate cancer, are twice as likely to develop the disease. Race, African American men are 60% more likely to develop prostate cancer in their lifetime than Caucasian or Hispanic men. Age, usually don't see prostate cancer diagnosed in someone under the age of 40. As I said, it's 1 in 10,000 men under the age of 40 will be diagnosed, but 1 in 15 men in their 60s will be diagnosed with the disease. And for diet, if you have a high diet in saturated fat or dairy, it's increased risk of prostate cancer. If you have any of these signs or symptoms, you should go see a healthcare professional to get these two tests done. First test is the PSA. This is the test is a blood sample that you get from your arm that is analyzed for PSA. PSA is a substance that is naturally produced by your prostate gland. Levels that are considered normal are about 4.0 and lower. If a man has above 4.0, this could be one of the first signs. The other one is the DRE exam. This is when a physical exam that your doctor will do to check for any growths in or enlargement of the prostate gland, any noticeable soft or hard spots on the prostate. To perform it, the doctor gently puts a lubricated glove finger of one hand into the rectum and checks the prostate. If there are any abnormalities in both of these tests, the next step the doctor will recommend is digital imaging or biopsy. These are the different digital images that you will perform that'll show tumors or anything that will be involved in your prostate. CT scan and MRI are one of the two main ones. And then if they see anything wrong, they're going to go in and they're going to get a biopsy, which would be the doctor guides a small probe into the rectum and removes 1 to 2 small tissue samples to further get examined to see if you have prostate cancer and which stage it has spread to. The 2 samples, or 1 sample, will be based off of it's called the Gleason score, which the Gleason score is based upon a 10-point scale from the sum of 2 different numbers. This will diagnose how aggressive your cancer is. The first number is based on where the doctor believes is most common, which is called the primary score, and the second number is where the doctor believes the cancer has moved to, which is called the secondary score. These are the different grades of what they will base those two numbers on, and then they will add them both together. If the Gleason score is 6 or below, cancer tissue is similar to normal prostate tissue and less likely to spread. If it's 7 or above, cancer tissue is very different from normal prostate tissue, and the tumor will be more aggressive and more likely to spread. After all these tests, your doctor will be able to determine which stage your cancer is in. These are the different stages of the cancer. Stage 1, the cancer is confined to the prostate. Stage 1 can't be detected during DRE and expected to be slow growing. Stage 2, the cancer can be detected during a DRE. It is still confined to the prostate, but the cells may be abnormal and may grow faster. Stage 3, the cancer is in tissues near the prostate and may have reached the seminal vesicles. Stage 4, the cancer has invaded other parts of the body, such as the rectum, nearby lymph nodes, or bones. Now that the patient has determined what stage of cancer it has, now the doctor can discuss what treatment options are. Everyone is different. Some people can do some different treatments, some people can't. There's a bunch of different factors. One of the few is active surveillance. This is an option for patients with very low risk prostate cancer and or their life expectancy of less than 20 years. Surgery, this is an option for men who qualify based on their overall health. Surgery is designed to remove the cancer through an operation. Depending on the stage, the doctor can surgically remove the prostate and or nearby lymph nodes for precaution, or if they believe it has spread to nearby areas. You have chemotherapy, uses drugs to kill cancer cells or restrict their growth. This is prescribed in cases of recurrent or high-stage prostate cancer. External beam radiation therapy uses high energy beams outside the body to reduce or eliminate tumors inside the body. Or the brachytherapy, which is also called seed implantation, is a form of radiation therapy used to treat prostate cancer. For as bad as a disease cancer is, prostate cancer is one of the better cancers to be diagnosed for men according to survival rates. As you can see, the 5, 10, and 15 year are all over 95%. That includes all the stages of prostate cancer. If you wanted to break it down to just the stages, you have the local stage, which is about stage 1 and stage 2 cancer, and the relative 5-year rate is nearly 100%. If it was a regional stage, it's about stage 3 and stage 4 cancers that haven't spread to different distant parts of the body. That is also nearly 100%. And then the distant stage, which means the cancer is spread to other lymph nodes, bones, or other organs, the relative 5-year survival rate is 28%. So the case study, his name is Joe. He's a 53-year-old male, height 6'5", weighs 240, had prostate cancer, and had prostate and nearby lymph nodes surgically removed. He's now in complete remission for about 6 months now. Has a family history of prostate cancer. His father had it and is now a 15-plus year survivor. He's a smoker, but looking to turn a new leaf and quit with exercise. His sedentary lifestyle since early 30s, and only medicine used is Cialis to control urine leakage from surgery. And since his early 20s, he's had an atrial fibrillation. His risks, he's a risk because he's over the age of 45. If BMI is not a risk, he needs to be over 30. His sedentary lifestyle, that's a risk. He's been sedentary for 20 years. Family history, he has a family history. His father is a survivor. His FBG, his HDL, his LDLs are all not at risk. He has lower back pain and lower body joint pain. It's not a risk, but should be considered an exercise program and should have special attention. He's a smoker, that's a risk, and his blood pressure is pretty normal. Special considerations, since he has a work schedule and time constraint, Joe is looking for an exercise program to do at home. He has an elliptical, stationary bike, punching bag, upper body exercise machine, free weights, and yoga ball at home. So we're going to base that all off of what he has at home. He wants to get back to a healthy lifestyle. We're going to keep special attention on lower back pain and lower body joint pain. Don't need to watch his medications, considerations, since as now he's taking Cialis once every 3 days. Since Joe's at a high risk due to the following: age is over 45, he has multiple risk factors, and he is symptomatic with cardiovascular disease. Since Joe is at a high-risk patient, a medical exam must be performed before Joe can partake in moderate or vigorous exercise. There's no exercise testing due to Joe is not ready to start moderate or vigorous exercise. We're just going to start with a healthy lifestyle program for a couple months to start before we can move on to anything else. And a physician must be in supervision before performing a submaximal test for Joe. We're not going to do that since we're not going to do any exercise testing. For a warm-up, we're going to do that every day. Everyday exercises, no more than 50% VO2 max. Take 10 to 15 minutes, and should have about 2 or 3 different warm-ups to keep exercise interesting. Example, walk around the block. He has a dog, so walk around the block with the dog. Do a jump rope or do some dynamic stretching. For aerobic training, we're going to do that 3 to 5 times a week. Intensity, we don't want to go over 70% VO2 max, 20-30 minutes per day. And do something like take the dog for a walk, get on the stationary bike, his elliptical, and he has a punching bag, so that's a great aerobic exercise. For resistance training, we'll do 2-3 times per week. We'll start light with 40-50% of his 1 RM, and as he progresses, work up to 60-70% of his 1 RM. He should try to hit 8 exercises that involves major muscle groups, 1 to 2 sets of 8 to 12 reps. He wants to just get a healthy lifestyle, so we want to do a complete body workout. Work on different sections each day as resistance training. Upper body, we'll use exercise machines, free weights. Lower body, free weight and body weight exercises. Core strength, a variety of core exercises used with his body weight is all we would need. For flexibility, there's nothing wrong with being flexible. 5 days a week, every day we do some exercises. Stretch till you feel discomfort or slight tension of muscles. Hold each stretch for 30-60 seconds. Should be doing stretches that correlate with his resistance training, aerobic training. Upper body resistance training, we want to do prior some upper body stretching. And loosening up his muscles and joints by stretching will help relieve his pain in his back and in his joints. So we're going to want to do some lower body stretching, lower back stretching every day. And then for balance, we're going to do it 2 or 3 times per week. He's over the age of 50, so his neuromuscular balance is starting to decrease. So it shouldn't be more than 50% intensity. Depending on exercise, should be X amount of reps or X amount of time. And we're going to focus on basic support and neuromuscular training. Work with standing with eyes closed, one-legged stances, standing on unstable areas, and balance on the yoga ball, since he has one. For my conclusion, 1 in 7 men will be diagnosed with prostate cancer in their lifetime. If you have any of these signs or risk factors of prostate cancer, make sure you stay in communication with your doctor and stay up to date on the specific tests. Prostate cancer is a dangerous disease, but if you make sure you are educated about the disease and act early, data shows that you should be okay. And here are my references.